Many think of the NHS as a purely state-run organisation. However, much of the operational side of this is undertaken in partnership with the private sector. One such company that works in delivery is Totally PLC, which within its urgent care division provides high-profile services currently such as NHS 111 and urgent treatment centres. In its trading update today, it says that it's standing shoulder to shoulder with the NHS in the fight against COVID-19. The chief executive of Totally PLC is Wendy Lawrence, and she joins us now on the line from headquarters there at Totally PLC in Derby. Wendy, it's good to talk to you. A brief word, first of all, on today's update. 12 months ended 31st of March, EBITDA forecast to be ahead of consensus, but revenues slightly lower. What are the dynamics going on?
Okay, well, first of all, thank you for inviting me on, Jeremy. I'm thrilled with the results and actually being able to release today that we are ahead of consensus EBITDA expectations for the year that's just ended. Revenues were slightly down, purely based on the fact that we went through a protracted period of when Brexit and the general election, when the NHS was actually in purdah and couldn't release any new tenders or any new contracts. So they're not massively down. It was just impacted by those two general things. And of course, obviously, then in March we were taken over by coronavirus, and anything that was planned in healthcare was actually put on hold. So from a perspective of Totally, we're absolutely thrilled with the results that we've just put out this morning.
Okay, these contract delays, I think perhaps maybe that's the right way of describing them. When will we know if Totally PLC is awarded those contracts, and what sort of value should we attribute to them?
I think it's really difficult, Jeremy, because during the last year, when you look at all of the things that we did, we went out and did a fundraise, we did a big acquisition of Greenbrook Healthcare, we launched a new business, and all the way through that period, the whole of the country were being impacted by Brexit. By people being uncertain about what was happening in the markets, and then by the general election. So we were going through tender processes at that time, various tenders based on various values and lengths of time. So I don't know whether those contracts and those tenders will be re-established as they were originally tendered, or whether there will be new processes involved. What I do know with absolute certainty is, we will continue to stand shoulder to shoulder with the NHS while they're managing coronavirus, and my staff and my services are stretched just the same as the NHS services in terms of supporting everyone that needs healthcare at this time, and that waiting lists are growing. So the other side of my business that works with the NHS to manage waiting lists and to proactively treat those waiting lists positively. We know that when all of this eases off on urgent care, that the demands for our services on planned care are going to go through the roof. So it could be a very good year ahead for Totally, but I don't know when tenders and contracts are going to be let, and I don't think anybody else does in the world right now.
You mentioned Greenbrook Healthcare, this acquisition in June last year. I think at the halfway stage, you were talking about a 22% rise in turnover, in part because of this acquisition. What's the contribution for the full year from Greenbrook?
When we bought Greenbrook, we completed in June, and we were expecting a certain amount of EBITDA for those. They've hit that target as well as the rest of the organisation. So Greenbrook did add about 30% onto our urgent care revenues. All of those revenues were secured for a 2-year period of time. There was one contract that was due to end, that did end at the 31st of March, which was a small primary care centre in London. But that was all planned in when we did the acquisition. So Greenbrook have contributed exactly what we knew they would, and what we've been doing is integrating them into our urgent care business, making sure that we integrate all the back office function, and that's part of how we've achieved the EBITDA figures that we have, by having one HR system, one finance system, and everything else that you would expect with a corporate back office. So Greenbrook have done what we expected them to do. We'd got a new urgent treatment centre contract that we announced back in December, so it's not fair to say that last year we didn't grow. We did, but we just didn't quite get the opportunities on growth revenues that we expected. But we did secure new business, and obviously re-secured all of the other contracts that we'd got.
Yeah, just want to move on to take a look at some of the current trading and ask you how things are going in this current period. I know these numbers were up to the 31st of March, so we've got a little bit of April to consider. But what changes have you been implementing as a result of the coronavirus, which I guess is probably occupying much of your time, and the corporate response to the demands being put on the services that you provide?
Yes, I mean, as you know, in our urgent care division, we are a national provider of 111 services across the country, along with NHS and a couple of other private providers. So 111 demand, as we all know, because we hear it every day, is through the roof, because that's the entry point for anybody who is ill at this time. So we've had to change our services quite a lot to deal with that. So we have to apply social distancing rules in our call centres, just the same as every other business does. So we've been looking at how we maintain the levels of capacity during that time, laying out our call centres in different ways. We've increased the use of video conferencing for medical consultations, and making sure that we respond as proactively as we can. And we've also been launching some new services with the NHS as a direct result of their request for the management of coronavirus. So, for example, we operate a service out of Heathrow Airport for anybody travelling in or out of the country. We've got other services where 111 has changed the way that it is accessed. You can use 111 online, and anybody that's deemed to have coronavirus then receives contact every day, either via a text message or by a telephone call or a video conference with a clinician. And where we are the provider of 111, that is us that's doing that. So a range of different ways of how we flex to support the NHS. But yeah, we're very, very busy. We've increased the number of staff that we've got. We are shoulder to shoulder with the NHS in how we manage this, and making sure that, again, we are ready on the starting blocks to restart all of the planned care and waiting list initiatives as soon as the government feel that that's the right thing to do.
One of the things, of course, has been in the national press has been the pressure's been put on the 111 service. What sort of experience are you having in terms of trying to get some of the retired professionals back from their retirement? They'd been expecting to lay down the tools, but I know many of them have been encouraged to come back on. Are you getting much engagement from those that had previously had retired, wanting to come back in and provide services like the ones you offer through 111?
Yes, yeah, absolutely, a great positive result. So when the government put out that plea for people to return to work, on the first working day after that, we had over 200 telephone calls from GPs who were wanting to come back, and either out of retirement or semi-retirement, or where their GP practice had reduced the amount of work, they were volunteering to come and work for us. Not volunteering on a voluntary basis, of course, but obviously wanting to come in and do some work with us. So we have had a fast-track process for bringing them back to work, making sure that clinical qualifications obviously are still robust and that going through proper DBS checking processes. And we've had a lot of people returning to us. We also contacted any member of staff that had retired during the previous year and asked them, and again, a great response. People who work in healthcare, I think, have this natural tug on their heartstrings, but that when there is a situation like this, they do want to come back and they do want to contribute. So yes, we've had a positive impact from that.
As you said, of course, it's not a voluntary service. It's paid for, and of course, everybody runs these things on a professional basis. And indeed, your relationship with Totally's relationship with the NHS is a business one, and we have to consider the business side of this. I understand Totally has requested additional funding from the NHS and commissioners for the additional services that are being delivered. Of course, you've got a far expanded service than you'd normally get at this time of year. Is this just a question ultimately of sending a bill into the NHS, or are you under constant negotiation with them in order to get them to approve what you perceive to be the necessary expansion of services that you're delivering?
Yeah, I mean, I think the easy answer to that is there is, where we hold contracts, we don't have to go back and ask for permission. There are mechanisms for payment within those contracts. But where it's an additional service or a changed service, where the commissioners request that, we obviously provide them with what the costs are going to be, and they approve that. We we haven't had any discussions with any sector of the NHS where they are not agreeing payment at this point in time. We work with the NHS all the time, so we're a very trusted partner. We are shoulder to shoulder with them. We are linked into the strategic planning side of that. We have daily calls with the NHS to understand where they are, what the demand is like, and what the priorities are like. And that's the way we work. So we've been a key partner for them for years, and I think this is where we can leverage off that trust and off that relationship to make sure that they do know that we'll do what's required of us, and that we will do that in a high quality professional manner.
Just before we get into the share price, very quickly, I want to talk a little bit about staffing levels and the complexities of hiring in this very difficult environment. How is Totally PLC coping with staff illnesses? Do you have much exposure to the front line directly as an employer, or are most of your jobs administrative?
No, we have a mixture of employed and staff who work for us on a sessional basis, but obviously we've still got commitments to them as individuals. So we're impacted like every other business. You know, we've got staff who are having to self-isolate. We've got staff who are, you know, only able to work from home. That's why we've had to be a little bit nimble on our feet and make sure that we harness video technology where we can. We actually had a member of staff that died from coronavirus, which was one of our 111 call handlers, but who also worked on the front line in a hospital. She hadn't worked for us for a while, but that had an impact on the workforce. I think, you know, we're as impacted as everybody else, but we, like every other business, are making sure that where we can harness technology, we do. But the majority of our workforce are still coming to work. You know, myself, my back office, HR, recruitment, we are still at work. Where we can work from home, we do work from home. But yes, we're impacted like everyone else.
Of course, we continue to think about those, as you say, in the front line, and those that are suffering, and of course those that have tragically lost loved ones in this dreadful global pandemic we're going on to. Just want to quickly, in the final throes of the interview, just to quickly bring up a share price chart. Since I think the beginning of March to the end of March, you had a wonderful 26% gain or thereabouts in terms of the share price. Since then, there's been a little bit of money taken off the table. What's your message to shareholders in this febrile environment?
I mean, from where we're sitting, I'm thrilled with Totally in terms of how it's delivering, how it continues to deliver. None of us really want to live through a pandemic, but Totally was established. Its whole strategy is around supporting the NHS at times when demand is high. So whether it be through planned care and increased referrals, or indeed a pandemic, this is where Totally comes into its own. So unlike the majority of businesses that are listed on AIM and having to close down and are worried about, you know, when business will start up, our business has never stopped. Our business will continue to deliver, and we're thrilled with our results. We're in a good position where, you know, cash is good. As I say, the only negative message within the RNS this morning is that we were on slightly decreased revenues, but not significant at all, and that we continue to do what we said we would do, and will continue to do that.
Yeah. Well, as ever, we wish you the very best of luck, and of course the continued services to the National Health Service in these dire times. But Wendy, hopefully we'll be able to catch up with you in better times ahead, and face to face as well. But in the meantime, thanks indeed for joining us.
Yeah,
That's Wendy Lawrence,
nice,
Chief Executive of Totally PLC.